Okay, all set. Yeah, so this should be it's going to be a pretty basic primer on what sleep paralysis is, what the symptoms are, what it feels like when somebody has it, if it's a condition on its own or if it's like a secondary condition, how common it is, all of those sorts of things. So I guess if you just wanted to kind of start with what it is exactly.
Yeah, sure. So the basic gist of it is that it's normal physiology for your body to become totally paralyzed during REM sleep,
Mm-hmm.
okay, which is a specific stage of sleep. And it's a stage of sleep that tends to be more back-weighted, meaning you tend to have more REM in the second half of sleep than in the first half, and you tend to have, or many people tend to have a lot of REM kind of right before they wake up.
Mm-hmm.
And so, REM sleep is generated from neurons in your brainstem that send projections forward up to your cortex and kind of make dream content happen,
Mm-hmm.
and then also send projections downward into your spinal cord that mediate the paralysis, right?
Okay.
And those two circuits should be working in unison, so that like when you're dreaming and you're having active dream content, you are also actively paralyzed. And when you wake up, those things should go off in unison, right? So that when you go from cortical, dream content to reality perception, the spinal cord circuit should go with it simultaneously, right? So you go from being paralyzed to not.
Uh-huh.
And so sleep paralysis happens when that circuit gets like slightly off in terms of its timing, right? And so what ends up happening is that people will go from REM sleep where they're dreaming into wakefulness, and so that cortical circuit is disinhibited, and now you become perceptually awake, but there's a lag in the spinal cord circuit, and it's usually a lag that's like on the order of a couple seconds, right? So you transition from a sleep and dreaming state into a wakeful state, but the spinal cord process hasn't caught up, and so for a couple of seconds, the person's perception is that, oh, here I am awake,
Mm-hmm.
lying in bed, but I can't move. And it usually takes that circuit like a couple of seconds, the paralysis circuit, like a couple seconds to catch up. So people will like feel paralyzed for, like it's usually a couple seconds. It probably shouldn't really be more than 10 seconds. If it's longer than that, that's probably a different problem.
Okay. Does it feel like a couple seconds to the person, or is it possible that it feels like longer?
It probably feels longer, especially, the first time or couple of times it happens.
Yeah.
Because it's massively frightening
Yeah.
to people, especially the first time it happens, or first time people are aware of it. But I think, for people in whom it happens frequently, people get used to it, and then the few seconds really does feel like a few seconds.
Okay. So you're consciously thinking during this, right? Like someone who's had it before can be like, okay, I'm in sleep paralysis.
Correct. Exactly. Yeah, people
Okay.
become very, aware of it.
Okay.
And realize that can be like a thing that just sort of happens to them. And
yeah. I got it a couple times when I was a teenager, but when I got it, it was like right after I fell asleep, kind of like in that twilight period. Is that the same thing, or would that not be sleep paralysis?
I mean, it could be. Again, our understanding is that the paralysis really happens in a somewhat stage-specific sort of way, that it really seems to be particular to REM sleep.
Mm-hmm.
And most people aren't going into REM sleep usually very, very early after they initially go to bed, but there can be all sorts of circumstantial conditions that make that not true. So if you are sleep deprived, for example, then certainly that may happen, and would be more likely to make a paralysis perception kind of happen, or right after falling asleep. Or some other things. And there are definitely certain medical sleep disorders in which this is known to happen commonly. So in narcoleptics, for example, I mean, sleep paralysis is actually part of what's considered the clinical tetrad, or one of 4 cardinal phenomena that occur to basically make the diagnosis of narcolepsy.
Okay.
So it can be very common in narcoleptics. It can also be really common in obstructive sleep apnea also.
Oh, interesting.
Um,
Okay. Are there any other kind of common disorders in which it's a feature or symptom?
I mean, those are probably the 2 really most common ones. I mean, there's, the gist of it is that, anything that causes kind of like a rapid arousal, like out of REM sleep,
Mhm.
can be associated with this, right? And that happens with the apneas, right? Because basically people stop breathing for a short period of time, and then they take this big recovery breath, and like when they do, they get a big kind of squirt of adrenaline, and it creates a little cortical arousal. And so that's often, if you do that in REM sleep, that's often enough to kind of like, disrupt the circuit very instantaneously in terms of the, dream content. So you can transition to a wakeful period, state as a consequence of the apneic event. And again, the paralysis circuit in the spinal cord hasn't caught up yet. And so, but other things like that. So I mean, this is somewhat less common. But for example, there's something called periodic limb movement disorder that's related to restless legs. So people who have restless legs are people who, right before they go to sleep, feel usually something a little weird in their legs. Moving the legs voluntarily will kind of reduce or alleviate that funny feeling temporarily, but then that feeling comes back again, so people move the legs again. And what happens is they're doing that in wakefulness kind of voluntarily before they fall asleep, and then what happens is after they fall asleep and now they're unconscious, they will involuntarily continue to twitch a limb, sometimes with very metronome-like periodicity, and that's why they're called periodic limb movements. And by and large, these can be innocuous and not necessarily disruptive to sleep. But sometimes these limb movements can be sort of vigorous enough that they actually, again, like an apnea, will create a small cortical arousal. And same idea, right? If that were to happen in REM, then you might experience sleep paralysis as a consequence of that.
Okay. So is it most commonly related to one of those disorders, or can you also just have sleep paralysis on its own?
You can also just have it, for sure. But
Okay.
I would say that's somewhat less common. I mean, I think people that experience sleep paralysis, I would say, are most commonly experiencing it as a consequence of, something, a secondary feature, right? Like either narcolepsy or apnea.
And then is it also something that you can just kind of randomly get once or twice in your life and not, be diagnosed with having sleep paralysis? Like when does it become something that, like a disorder, a condition? Is it when it happens very often or?
Yeah, so there's no real diagnostic criteria for what makes something, a condition that needs treating.
Okay.
People that are having it commonly enough that, that it bothers them and they're potentially seeking treatment for it, would be people that I'd have a very strong concern have something like apnea or narcolepsy or something else that I'd want to potentially treat. So I would say it's pretty uncommon. I don't think I've ever encountered it where someone has sleep paralysis, very commonly, let's say, every day or even once a week or even once a month. It's not related to, like I said, some other condition.
Okay.
I've just not encountered that. So.
Okay.
But yes, to answer your question, I mean, it can happen once in a while and be a normal thing.
Okay. And it's nothing at all to worry about.
Correct.
Okay. Can you tell me a little bit more about what it feels like? I mean, I know you feel like your body's paralyzed, but are there any kind of, like, how would you describe, like, the sensations or the feelings, or do people ever have, like, I don't know, or visions of something, or is there, like, a a characteristic feeling, that kind of stuff?
You know, because again, because of the physiology that kind of makes this happen, right? This sort of rapid transition from a dream state to a wake state. You know, sometimes there is some funny, you know, experiential phenomenology that goes with it, right? So sometimes, because people have just, you know, woken up from a dream, they can kind of have the feeling of not being certain, right, of whether, like, you know, where they are, or whether they're still in the dream. Like, am I in the dream? Am I not in the dream? Right, like that kind of thing. Or sometimes even have what we consider like a frank hallucination, right? Like, sort of feel like, oh, I'm not in the dream. Like, I know I'm awake and I realize I'm in my bedroom, but like, oh, I'm seeing, you know, whatever, this dog or something, right, that I was just dreaming about, right? So that can definitely happen. That kind of stuff along with it. But you know, it's not uncommon for people just to be, or have the phenomenon of just you know, feeling, you know, like they're normally awake, right? Like they've just woken up from sleep, but just being unable to move for a few seconds, and it is often, you know, frightening. You know, certainly the first time it happens.
Yeah, I feel like this is the kind of thing that probably used to be attributed to, like, I don't know, like demons visiting in the night or something. And is that just kind of
absolutely. You know, there's artwork about this, right? Do you know the artist Vasily, who has a painting that's, I believe, called The Nightmare?
Yeah, I'm looking at a photo of it right now, actually. Yeah, is that just kind of like a myth that people commonly see, like a demony, shadowy figure over them? Or is that something people do experience?
My understanding of the etiology of that myth is that it's a little bit related to apnea, actually.
Oh, interesting.
Right? Which is that, you know, you're right, like that you stop breathing momentarily, and then you have this big recovery breath, and that like kind of wakes you up, and then like you have the sleep paralysis for a second. But because what was happening immediately before that was that you were actually not breathing, people will describe that, oh, I felt like someone was like pushing on my chest, right, and like preventing me from breathing. And then people attributed that to little, you know, goblins and gremlins that were the ones sitting on or pushing on the chest, which is the etiology of the Facility painting. Or that's at least my understanding of the explanation.
Okay. I mean, that actually makes sense for how we explain things back in the day. Are feelings of like panic or fear pretty common, or is that really only the first couple times maybe somebody has it and then they know what's going on?
Yeah, I mean, again, my experience is that there is panic or fear the first, you know, 1, 2, maybe 3 times it happens, but after someone's experienced it a few times and realizes that that it is transient, that it, you know, doesn't have any other carryover effects into waking life and everything, that people just, you know, they become less fearful of it, I think appropriately so.
Okay. And then is there anything you can do about it? Is there any way to prevent it or things to avoid doing? Would, I don't know, stress or lack of sleep or having a drink before bed, would any of those things be a factor?
I'm not specifically aware of, you know, specific, you know, aggravating factors, right? You know, anything that potentially, you know, aggravates apnea would, you know, may aggravate sleep paralysis as well. So that can include things like alcohol, right? Alcohol kind of relaxes muscles, including the muscles that surround your upper airway, makes it more likely for many people to snore and or have an apneic event. But yeah, outside of that, I don't necessarily know any triggering factors.
Okay. And then are there any kind of like treatments? Are there certain like I don't know, like relaxation things you can do before bed or anything like that? That would be helpful. Any kind of medication?
Not specifically. I mean, again, I think it's important to, rule out any sort of secondary condition that might be contributing, and of course it's important to treat that. You know, for narcoleptics, for example, part of the reason why narcoleptics have this phenomenon is because they lose neurons that use a neurotransmitter called orexin. And one of the things that orexin does is that it's state stabilizing, meaning that when you first fall asleep at night, you should go into non-REM sleep, and so orexin acts to kind of keep you perpetually in non-REM sleep for a while, and then eventually you'll transition into REM sleep, and orexin acts to then kind of keep you perpetually in REM sleep for a while. And then when you finally wake up for the day, orexin acts to keep you perpetually awake for a day. And so part of the reason why narcoleptics are very sleepy is because they lose that, and what a narcoleptic sleep looks like is that they go from wake to non-REM, and then immediately they're like back to wake, and then immediately into REM, and then they bounce around like very quickly between the three states, between wake and non-REM and REM. And because they're bouncing around so quickly, at the end of the night, they might bounce right directly from REM to wake very quickly, and then they can have sleep paralysis, right? And so one of the treatments for narcoleptics is actually to give them medicines that promote sleep consolidation in order to kind of prevent all this bouncing around and all this sort of sleep inefficiency in order to make their sleep more efficient. And it's supposed to help with, improving daytime sleepiness, but it also supposedly limits the sleep paralysis. Now, for somebody that has sleep paralysis alone, like I wouldn't necessarily, be thinking strongly about the same approach because it's just a risk-benefit sort of analysis, right? It's like, there's always risks to these medicines and things, and like if you're really improving like multiple outcomes with that, i.e. you're limiting the sleep paralysis, but you're also really improving daytime sleepiness, which is a huge complaint among narcoleptics, then it may be worth it. But if the only issue is the sleep paralysis and you're not going to be improving some other aspect, then I personally probably would not be looking to use medicines in a sleep consolidating way the same way I would for a narcoleptic, for example.
Yeah. Okay, so bottom line, it's not simple, it's transitory. If it happens to you a couple times, there's not really much to do about it, so don't worry. If it's a persistent problem, then probably see a doctor to see if you have something else going on with sleep apnea.
Yeah, absolutely.
Okay, great. Unless you can think of anything else I didn't ask about or that's important to know about the condition, or would you even call it a condition, or is it just kind of a state?
Yeah, I mean, I would say it's a phenomenon that can be associated with certain sleep conditions.
Okay. All right. Awesome. I think that about covers it then.
All right, great.
Great. Thank you for your time.
Yeah, absolutely. Like, keep Rachel posted if and when this ever gets written up.
Will do.
Cool to see.
Yeah, definitely. I imagine it'll go up sometime in the next month or so. I've got a whole batch of things I'll be sending them soon. So it might be a little bit, but I'll let you know when it's up.
All right, great.
All right. Thank you. Have a good one.
All right, take care. Bye.
Bye-bye.